Okay, welcome. My name is Bruce Butler, and I'm the CEO of Samaritan Health Plan. I am just really excited to be able to spend some time with you today. It's a real privilege. I've personally worked in much larger national health plans previously, and this is the kind of thing that executives don't get to do in plans like that. So it's really a privilege to be able to connect with community members from the vantage point of our health plan, which is much smaller, much more geographically focused, and deeply committed to our community. So thank you again for being here. Just one quick check on a couple of things I'd like to make. If you have logged in to our Microsoft Teams meeting, and for some reason you're not seeing the slide, sometimes that does happen on Teams with technology challenges. So I would just suggest logging out and then logging back in. That often takes care of the problem. Another thing I just want to mention for the record is that this meeting will be recorded, and that's for the purpose of making the content available to others who might learn from it going forward. So again, thank you for being here. It's just a great privilege to be able to for an executive of a health plan to be able to connect with community members like this in a way that can't be done with larger scale organizations. Another thing that is very different about Samaritan Health Plan is our close alignment with our parent organization, Samaritan Health Services, your hospital and healthcare system in your community. We don't exclusively work with Samaritan Health Services providers. We work with other community partners as well, but that deep connection with the Samaritan Health Services delivery system enables us to coordinate in ways that we really believe can be a benefit to you as our members. We really thank you for being willing to take the risk of making a change and giving us an opportunity to serve you in the coming year. It can be a little bit concerning, we know, to change health insurance plans. There's a new set of procedures and materials to become familiar with. But I want you to know that myself and more importantly, the team that I work with at Samaritan Health Plans is deeply committed to doing everything possible to making your experience with us a positive one. There are challenges. We know that almost everywhere in the country now, accessing care can be a challenge. Healthcare systems everywhere are overwhelmed. Our parent organization, Samaritan, is doing everything it possibly can do to add capacity in primary care, internal medicine, and other related areas. Our other community partners like Corvallis Clinic, like Corvallis Family Medicine, are also striving to improve and build their capacity. And we're doing our best to work with them. And we want you to know that we're here to help you any way we can, whether that's helping you go through our provider network to find areas, to find providers who have open practices, answering questions about different pharmaceutical eligibility, really whatever it takes to help you in your healthcare journey. We want to be here for you. I do want to acknowledge that there, as I'm sure many of you have been aware, there have been a lot of changes in the marketplace in terms of other health plans um, changing their contracting status with providers in our community, including Samaritan, including Corvallis Clinic, other health plans exiting parts of the market. That in turn has presented us with challenges operationally. We have almost doubled our membership um, over the last several months. And I want to acknowledge that that's been a challenge for us. But I also want to assure you that, again, the team that we have in place is deeply committed to serving your needs. And as leadership of Samaritan Health Plans, I and the rest of the leadership team are working very hard to make sure that our capacity, our service level capacities increase along with the new members that we are so privileged to serve. So let's go to the next slide. I just want to make sure that some very basic information is out there and available for you. Hopefully everyone can see this, a variety of resources that can be valuable to you. Our website is listed. Our customer service call center is available to you. I do want to make a special note that there have been, of course, many questions about our parent system's contract termination with United Healthcare. That's something that actually we on the health plan, in the health plan arm of Samaritan, are really not well positioned to address. It actually would not be very legally appropriate for us to get too involved in conversations like that because it's a bit of a conflict of interest, frankly. So we really want to direct questions about the Samaritan hospital and physician group's relationship with United Healthcare over to the regional billing office at Samaritan, and that's their number listed on the slide in front of you. So moving forward, just a few housekeeping items. Everyone who's registered for this session will be receiving an email within the next week or so. That's going to contain an evaluation form and some links to additional information. We'd love to get your feedback. So please, if you can, fill out that evaluation form. We would appreciate it. And then later on, in late February, we will be posting all of the frequently asked questions from not only this presentation, but all of the both virtual and in-person presentations compiled together, so that you can see what kinds of questions others have been asking, and hopefully get a lot of good perspectives from that as well. So with that, by way of introduction, again, thank you for being here. I'm going to turn things over to a couple of real experts, Danielle Hunter and Carrie Shin from our team are going to be taking you through some additional information about our health.
Thank you, Bruce, for the handoff there. I'm Carrie Shin, and again, Danielle's here with us, and we're going to first review with you a bit about the website. We understand that technology can be a bit tricky at times, but we hope that you find how the website is organized and the resources that we have available to you is very beneficial. So I'm going to get us over to the website at samhealth.org. So on the web page, as you may see at the very top here next to our logo, we have some very quick links that we'll talk about a bit later, but there's the Find a Provider and Find a Drug link. Then if you want to get into some information about your medical claims and where you're on your deductibles, and you can go into My Health Plan and set up an account to be able to access information related to your insurance within Samaritan Health Plans. So if you're not already familiar with that and want to go into My Health Plans, you can also check on your benefits card information as well through this My Health Plan. We also want to point out that there's the Samaritan Health Services side of the organization, and there's a quick link here. So if you are wanting to get into that website to look up certain doctors or to pay a bill or just navigate the Samaritan Health Services itself, you can certainly switch to that website. And we also want to point out that they have a different platform called My Chart, and this is where you can go in and have messaging back and forth with your primary care doctor, or doctors in general. You can check your labs, you can refill medications, pay bills, and so forth. So these are two separate websites and two separate platforms with two different purposes. So we're going to go back to the Samaritan Health Plans website. So back to the top here, you'll see there's a members drop-down section. If you click on that, you can select Medicare Advantage members, and this will give you a variety of links here. You can go to your benefits. If you click on that link, it will get you to some information about the benefits card or rewards and incentives program, which we'll be talking about here later. There's also down below some linked documents for information overview of your plan benefits. So we want to make sure you have this available at your convenience. The summary of benefits document give you an overview of each of the plans, and the evidence of coverage document is more like the contract language. It still gives you an overview of your plan benefits, but it's probably good bedtime material and maybe something you may or may not have a desire to read through too much. But if you have any questions, we certainly encourage you reach out otherwise to our customer service team. And going back here, you can see that there's a couple ways to navigate to where you were. You can use the back feature on your browser. You can go back to Medicare Advantage members page, or you could even select here to see the path that you took to get to where you are. So sometimes people kind of get lost in, oh, where did I see that information? And perhaps these links will get you back to where you're looking for some key information. Again, under this main image on the members page, there's going to be information about the benefits MasterCard. Again, the quick links that are also at the top: find a provider, find a drug. There's forms for members that you may find helpful from time to time. There's the reimbursement and claims, or I'm sorry, reimbursement and appeals forms. There's a variety of other things: how to appoint a representative, or to set up an authorized representative for your account. If you want us to be able to disclose information to a family member, friend, or neighbor, we need to have that permission on hand or on file for us to be able to do that should they contact us. So those may be some forms to take a look at. Even for spouses or partners, we need to make sure that we have that information. We can't otherwise disclose information to them without it. And then finally, there's a pay a bill link here. If you're wanting to go into Instamed, you can go into Instamed and pay your premium bill. There's also an option to sign up for paperless billing or statements, I guess you could say, under the Instamed feature. So that would be something to do if that's of interest to you. And again, just to review, this is the Samaritan Health Plans website, the insurance side of the organization. My Health Plan is a way to send also a secure message to our customer service team. If you have any questions, you can certainly do it that way. And then there's again the Samaritan Health Services side of the organization with that handles the clinics and providers and billing for the Samaritan services that you may receive. And I'm going to have Tanya come on here, and she'll be going over some of the provider information with you.
Good afternoon, everyone. Hopefully you can all hear me. My name is Tanya Smith, and I am a provider relations representative for Samaritan Health Plans. Welcome to being a new member with us. We're excited to have you. As new members, you will have a robust directory of contracted providers in which you can use. Our contracted providers or in-network providers are facilities, providers, labs, hospitals that have all agreed to take you as patients. They have signed an agreement and have been credentialed as needed. You might also be seeing out-of-network providers as you're transitioning to our new plan. Those are providers that have not been credentialed and have not signed that contract. If you are seeing a provider that is out of network and they are interested in possibly contracting with us, please have them submit a letter of interest form for us to review. Our network strategy and contracting team is continuously reviewing the network and looking to add any additional providers as needed to help meet the needs of our patients and our members. Next slide, please. For 2024, Samaritan has rolled out a pilot program that is called tiered networking. This is a gold and silver tier that is a special contract with our Samaritan Health Systems. This will be for any inpatient or outpatient hospital, ambulatory surgery centers, primary or specialty care services that are provided at our Samaritan Medical Group or Samaritan hospitals. And in just a moment, I'll be showing you how you can tell whether or not a provider is considered a gold tier and if not, a silver tier. So next slide, please. As members, there's always many options for you to find out who our contracted providers are. You can always contact customer service, or if you'd like to look for yourself, you can come out to our website. And again, that website is www.samhealthplans.org. Once you get out to that site, you will select Medicare members. And then as you are given an option, there is a directory, and you'll be selecting the Find Care. And if you click on that little picture that says Find a Provider, you'll be taken directly to our provider directory, where you'll have two different directory options to pick from. One of which is going to be our facilities. That is going to include your durable medical vendors, laboratories, or hospital and ambulatory surgery centers. And for today's purposes, we're going to actually dive a little bit deeper into the provider network directory and our in-network providers there. So when you click on that top blue button, it will immediately take you to our directory. The directory can be exported in both Spanish and English. We do not typically print this because it will take approximately 3 reams of paper. Another reason we would not want to print it is because this directory is updated daily. We are constantly adding new providers. They're continuously opening and closing their panels. So for best recommendation would just be to continue to contact customer service or check the directory daily to see if any new providers have joined or if they're open to accepting patients or not. So on the left-hand side there are a few filter options. You can see how many members there are. I believe there's, I forget, like thousands and thousands of options to choose from. By using the filter buttons, you can filter by the gender of the provider you're looking for, the city in which they reside. You can search by specific specialty, and that will help you drill down what you're looking at. This is also where you'll see whether a provider is considered a gold tiered provider or not. On the right-hand side there, if you see the words gold tier, that will indicate to you that the provider is gold tier and will have a lesser cost share. If you do not see the words gold tier written there, there's a silver tier. They're still in network, still contracted for you to see, but would have a different cost share than the gold tier members. Next slide, please. In using the filters, we're kind of going to drill down a little bit, and we're going to look for providers that are accepting new patients and those that are a primary care provider. As you drop down the filter options, you will select true for each of those categories, and that will automatically drill down the options in which you can see which providers are indeed accepting and open, and which ones you can see as of that day. We rely on our offices to provide us updates to their panel. So again, you might see one day that they are not accepting, and a week later they might actually have opened their panel. In this example here, you can see that the words gold tier are not there. So again, this is an example of a silver tiered provider. It doesn't say silver tiered, but if you don't see gold, it's silver. Thank you very much. At the end of today, we will have Jenny Harper available. She is another one of our provider relations representatives to assist you in maybe providing you answers to some of your questions related to providers. And we look forward to working with you. Thank you.
Thank you, Tanya. So we're going to continue on here. We're going to talk a little bit more about the network, but we also are going to highlight some of the key benefits that I know that there's a lot of questions about, and hopefully give you some more valuable information on how to use the benefits available to you. First, we want to clarify that you would receive one of these cards in the mail, or should have, as a member of the plan, and there are 3 different cards here, and the back of the cards is all going to be the same. But the key things to differentiate these cards are the plan name that you have. So at the top of each of these cards, it would indicate what plan you have within Samaritan Advantage Health Plan. We have the Premier Plan, the Premier Plan Plus, and then the Valor Plan. And other than the plan name appearing different here, the only other thing you might notice is different is that the Valor Plan does not have the Medicare RX logo like these other 2 plan cards do, because the Valor Plan is a medical only plan and it has no Part D prescription drug coverage. On the flip side of each of these cards, you would see some contact information for you and for providers to be able to reach out to us if there's any questions or concerns about your benefits. Continuing on a little bit with what Tanya was sharing, we have a network of providers. We are an HMO health maintenance organization plan. So the general idea is that members use the network of providers that we have in order for services to be covered. Our network, if I were to describe it, I would say it includes the majority of providers in Linn, Benton, and Lincoln counties, as well as hospitals and specialists between Portland and Eugene can also be found in our network. So it isn't just Samaritan based. And there are some exceptions to the benefits in the area of travel. For example, we know we have a lot of snowbird members or members that like to travel, and we encourage you to do so. There is worldwide emergency care coverage and nationwide urgent care coverage within the plan benefits. So those are some exceptions to what is otherwise the HMO network that we have. There's also exceptions for kidney dialysis, and also for x-rays, flu vaccines, hearing aids and hearing aid fittings, labs, and then routine eye exams and hardware are also some exceptions to the network.
So this actually, that point, Carrie, sorry, addresses one question in the chat, which was, what is the coverage for international travel? So you have worldwide emergency care, and so that is for being admitted through an actual emergency care, and that does not include drugs or transportation as part of that.
Thanks, Danielle. We're also going to share with you the personal emergency response system that we have available. This is new for our plans this year, and this is a partnership we have with Medical Guardian. That is the company you would connect with, and you would have gotten information about this benefit in your new member packet, amongst some other benefits we're going to talk about as well. But you would be able to reach out to Medical Guardian, and their phone number is listed on the slide. And you can get a device in different forms. There is the device that you can get to wear around your neck or clip to your pants or purse. There's also more of a watch form to the device. And they have different features to them in addition to just being an emergency alert, but they are water resistant, so you can wear them in a shower or bath, perhaps. But you can, make sure you're safe even in those circumstances. But this is for any emergency. It's not just for a fall situation. It's for any time you feel there's an emergency or threat to you or a loved one, such as a pet. And there is no copay for the device nor the service, and it uses cellular connectivity, and this is available under all 3 of the plans. Transportation, we partner with Cascades West Ride Line, which is a local transportation service, but for our benefit, there is no distance limit. So if you do need a ride from the coast to the valley or up to Portland for your medical needs, this can be a service available to you. You would basically coordinate your need with Oregon's Cascade West Ride Line, and their phone number is also on this slide. Again, this should have been a piece of your new member packet to be able to utilize this benefit. And the ride service is available 24/7. They offer ride transportation in a sedan or a van for your wheelchair needs, as an example. And the hours of operation are Monday through Friday, 8 to 5 for your coordination of ride services. But again, the rides themselves can be operational 24/7. This is a benefit available to use to and from any health-related location. That includes grocery stores, fitness facilities, religious facilities, coming to our office to talk about your insurance, going to the doctor, the hospital, pharmacy, any health-related location. This service would be available to our members through Cascades West. Another benefit to highlight is the Silver and Fit benefit. This is another partnership we have with Silver and Fit. They offer a variety of facilities that they contract with nationally, as well as some local options. And not only do they have facilities for you to use for your fitness needs, but they also have online resources, they have coaching, they have virtual classes, they have devices and kits that members may get. Those home kits can be things like walking and trekking oriented for Pilates, yoga, or others. And if you wanted to utilize this benefit, you would reach out to Silver and Fit, and their phone number again is here, as well as their website. And you would reach out to them to coordinate your desire to use their program under the contract that we have with them. So you would, if you're on the Premier Plan Plus, you would not pay any fees to be a part of the Silver and Fit program. But if you are on the Valor Plan or Premier Plan, there are some one-time per year fees that may apply to what you're wishing to do with the program. On the Premier Plan, if you want to have a fitness facility to access, you would pay one time per year a $25 fee to Silver and Fit to have that fitness facility access. If you want to have a home kit, you would pay a $10 one time per year fee under the Premier Plan or the Valor Plan. Under the Valor Plan, if you're wanting to have the fitness facility access, you would pay $50 one time per year to have it under that plan of ours. Or if you want to have the home kit and the fitness center, then you would pay the 2 combined fees. Next, we're going to talk about the Benefits MasterCard. This is a MasterCard that we hold 4 benefits under, basically. There's 4 different benefits that operate under one MasterCard. And this is a card that you should have gotten shortly after enrollment, or if you were enrolling for January 1st, you may have gotten this more at the beginning, middle of December timeframe. The Benefits MasterCard holds funds available for the over-the-counter allowance, the dental allowance, the eyewear allowance, and the hearing aid allowance that each of the plans have, with the exception that the Premier Plan and Premier Plan Plus are the two that have the hearing aid allowance. And if you need to ever check on the balance of what you have available under these benefits, you can go into that My Health Plan portal I mentioned earlier when talking about the website, and that's one way of checking on the balance you have. You can also call the number on the back of the MasterCard to check at that as well. But these are 4 separate benefits operating under one card with their own dollar values associated. And we're going to break this down a bit more so that you become more familiar with it if you're not already. So for the over-the-counter benefit, each of the plans have a quarterly allowance. And this is not a rollover allowance. It's use it or lose it. So every calendar quarter, your allowance is replenished. And if this is something that you can use for a variety of over-the-counter items. It could be cold, allergy medication, bandages. It could be used for dual-purpose items such as vitamins and so forth. But there are 3 different ways that you can use this over-the-counter allowance. One is by utilizing or getting items through the catalog that is associated with this card. And this catalog lives on our website under the Benefits MasterCard section, if you recall me showing that earlier on the website. But if you order any items through that catalog, you would use your Benefits MasterCard to pay for it, and they will ship them to your home. So the card and the catalog are best friends. It's a seamless transaction, and the items will be sent to you. Another possible way of using your over-the-counter allowance is through most retail stores and pharmacies. Now, what it does come down to for this to work seamlessly at those outlets is the items that you're purchasing do have to be registered by the merchant as an over-the-counter item that the card recognizes as an eligible expense that it can pay towards. So if that doesn't work for the items you're wishing to purchase at a store, you can submit for reimbursement, or if you are purchasing dual purpose items outside of the catalog, such as vitamins, you would need to submit for reimbursement. So there's 3 different ways that you can use this over-the-counter allowance. Then that's again by the catalog, the retail stores or pharmacies potentially, or through reimbursement. So that's one allowance that's under the card. Again, the other 3 include the dental, eyewear, and hearing aid allowances. And these allowances are automatically loaded on your card, and they are an annual allowance. So a use it or lose it benefit for the calendar year. And as far as the dental services are concerned, it covers cleanings, fillings, crowns, root canals, x-rays, dentures, implants, extractions, fillings, did I say that? It includes basically anything but orthodontia. So if you have any dental needs, you're welcome to use the benefit card. We do not actively contract with dental providers. We keep the door open to any dentist that has not opted out of Medicare, in other words, that accepts Medicare. So it would be advised to check with the billing staff of a dental clinic to verify that they have not opted out of Medicare, since they would know the latest and greatest on that status. For the eyewear, you can basically, again, use this card anywhere to purchase frames, lenses, or contacts. It could be used as a debit card, and you would use this at basically any retail store that it can recognize it's paying for eyewear. Hearing aids, again, this is available under the Premier Plan and Premier Plan Plus, and this benefit is an allowance specific to those items. and you can, again, use it at any outlet that the card will recognize it's purchasing a hearing aid or supplies to a hearing aid. So a little bit of a recap is that these benefits are 4 separate benefits under one MasterCard. It's not a lump sum of money to use under any 4 of these, towards any 4 of these services or benefits. Each benefit has its own dollar amount, and those dollar amounts can vary by the plan that you have with us. And also, to be clear, there are some things that we don't want to confuse over how you would use the benefit card. If you're otherwise having Medicare covered dental services, which is pretty rare that somebody would have a Medicare covered dental service, but if you were, that needs to be billed to the insurance as a claim rather than using the MasterCard, the benefits card. Also, if you're having routine eye exams or medical eye exams, those are a claim to the insurance as well, so you would not use the benefits card for that. And finally, if you're having any hearing exams, those would need to be a claim submitted to the insurance to provide coverage. We also are excited to have a rewards and incentives program. This is a program that we started last spring, and this provides a reward to our members for having certain preventive services or items taken care of. And this can give, depending on the item and what the doctor basically puts in order for you, you can earn $10, $20, or $25 back in your pocket. And the way this works is you would be issued a a rewards and incentives card that looks a lot like what you see here on the slide. It does look a lot like the benefits card, but it does say rewards and incentives at the bottom of the card. And you do not get this card until you have a qualified service or item completed. So this would not have been sent to you right away like the benefits card and member ID card. If you have any one of these services, it can take up to 60 days to run through the claims process and for the vendor to send out this card to you. But we would, on the back end, notify that you've earned a reward. And if they hadn't already issued you a rewards and incentives card, you would be sent that. And for that service and any that follow, you would be receiving more money loaded on that card. These funds can then be spent at a grocery store, on your co-pays, or at a home improvement store, for example. And the amount you earn is good or accessible to you. So the amount that you earn in 2024 will be accessible to you through June of 2025. If you're a member at that time, you would still have up to that length of time to use the funds that you have earned from the previous year. If you do leave the plan prior to the end of the year or at mid-year time, you do have up to 90 days to use the funds that you had earned up to that point. And I'm going to have Danielle take over here and talking about some member materials.
Thanks, Carrie. So Carrie talked a little bit already about the new member packets that hopefully you received by now. If you haven't, you can contact customer service and they can have a new packet ordered for you that has a lot of valuable information for you, including how you access certain materials that are available online, like the provider directory, formulary, and evidence of coverage that we don't mail out. And then inserts on most of the benefits that Carrie talked about today, the PERS, Personal Emergency Response System benefit, transportation, Silver and Fit, all of those great things. A question that we get a lot is, why do we send so much mail? Between us, and especially now that we are your health plan, and if you have a Samaritan provider, you will see Samaritan in your mailbox quite a bit. The majority of the mail that we send, we are required to send. So that's everything from the new member packets, information that comes with your enrollment, explanation of benefits for your medical claims and your pharmacy claims, all items that we are required to send you. We try to limit the amount of non-required mailings just because we know that it's a lot. If you do want hard copies of some of the materials that we don't send, you can, again, contact customer service and they can order those for you. The points that were already made for the provider directory, we don't recommend a printed version of that because it's quite large and goes out of date basically the moment that it's printed. Another document that will be talked about in a little bit is our formulary. Another large document. It's a lot of paper and is updated at least monthly. So that can also go out of date if you keep a printed version of that. And then the evidence of coverage, which is your member handbook, kind of contract language. It's around 200 to 300 pages, a lot of information, but again, a lot of paper. But if you do want to have those for your records, we can certainly mail hard copies of those to you. And I think with that, we'll pass it over to Marika, who will talk to you about your pharmacy benefits.
Good afternoon, everybody. My name is Marika Davies, and I also have one of our pharmacists on the line with us, and her name is Katie Malina. And we are going to be talking about some of your Part D benefits today. In particular, we're going to be talking about two of our most requested features on the website, and that's going to be how to look up what drugs are covered and where you can pick up those drugs, so our pharmacy network. We're going to be starting out talking today about limits and terminology that you might see when you're navigating through these tools. And first and foremost, what is a formulary? So a formulary is a list of covered drugs by the plan. It is in place to increase safety and minimize your costs. Certain drugs have limits and require additional review. One of those additional reviews could be a prior authorization, and that can be seen as either PA or the little yellow box that says prior authorization. And this just means that for certain drugs, a prior authorization is required and you would need to get approval from our plan before you fill this prescription. Another terminology you could run into would be a quantity limit, and that's often abbreviated as QL, or the little gray box where it says quantity limit. So our plan limits the amount we cover for some drugs. For example, our plan provides 60 capsules for 30 days for omeprazole oral capsule delayed release. We also have step therapy, and that is abbreviated as ST, or the little box that says step therapy. And that just means if there are two drugs that treat your medical condition, we will require you to try drug A before we would approve for you to try drug B. And then we also have what we call our formulary exceptions. You can ask for an exception to our coverage in two different ways. You can ask us to cover a drug that is not on our formulary, and you would see that abbreviated on our formulary as NF, or this little orange box that says non-formulary. Or you can waive coverage restrictions or limits on your drugs. So, for example, we had talked about earlier a quantity limit of the omeprazole of 60 capsules per 30 days. If your prescriber wanted to prescribe 120 capsules for 30 days, you could ask us for a formulary exception to waive those coverage limits. Carrie, I believe you are sharing your screen. I am going to go ahead and have you stop sharing, and I will share mine so that we can do a live demo of how to use our resources online.
Thank you.
Carrie, are you able to see the screen?
Yes, thank you.
Okay, fantastic. So kind of like we talked about in the beginning, Carrie had shared, this is our main landing page for the health plans. And there are headers here at the top. we are going to navigate to Find a Drug. And then the line of business is Samaritan Medicare Advantage. And there's two ways that we can look and see what drugs are covered. And it just depends on what your personal preference is. So we're going to walk through both of those today. And the first one that we're going to talk about is down here. And it is labeled 2024 Formulary, Premier Plan, and Premier Plan Plus. And it will tell you the effective date. So this is effective for this month of February. And if you click on it, it will bring up our formulary. There are several ways that you can use this. As you can see, there are quite a few pages. And it is broken down for searching in two different ways. So you can search by medical condition. So you can see here the therapeutic class. Or I don't always know all the therapeutic classes or categories that my drugs fall into. So I heavily rely on the index of drugs. So the index of drugs is going to be alphabetical. And you can just go down and find the drug that you were looking for, and it is going to correspond to a page number. I put this on a separate screen so I wasn't making you guys sick and going up and down and scrolling through several hundred pages. But I wanted to make sure that you knew that the index of the drugs was at the back of this document. As you can see, we have our information. It has the drug name, the drug tier, and if there's any requirements or any limits. So the one that I wanted to highlight today that has two of those symbols we talked about is the lidocaine ointment 5%. So we can see it's on a tier 4. It has that QL, so we know that stands for quantity limit. And it's 150 grams per 30 days. And we also see that it says PA, so we know that means it requires a prior authorization. Now, one thing about using the PDF to look up and see what drugs are covered is that there's nowhere on here that you can click and have it take you and see what is that prior authorization. So in order to find out what that criteria is, you would have to come back to this landing page, and we have this listed under drug lists and other requirements. So the criteria, the step therapy criteria, and the quantity limits. From there, you can open, and then you would have to scroll through and find the drug. I don't think that this is the most interactive, since you do have to go several locations to find what you're looking for. But some people prefer to do it this way, and we are going to go back and look at another way to use the formulary tool, which is a bit more interactive. And personally, I like using this tool a little bit better. So again, we're back up at the Find a Drug under the Medicare Advantage. And then this little blue hyperlink where it says Premier and Premier Plus Plan online formulary. So we can click, and it's going to ask if we want to leave. We can go ahead and say yes. And then from here, again, you can search alphabetical. So if you wanted to look up omeprazole, you could click the O. If you knew what therapeutic class it's in, again, you can click on here. Any of these blue links where it allows you to click, you can. My favorite way to use this, mostly because they have a lot of tricky spelling of drug names, is just in this search bar. So we looked at lidocaine, so I'm going to go ahead and search for that again. So I'm just going to start typing. And you'll see that if I don't know what strength my prescriber provided, you can scroll through here, and if you keep typing, it's going to go ahead and keep pulling up. I like to call it, did you mean this? So you can either scroll through and click, or simply hit search. Now I'm going to make this a little bit bigger, because as you can see here, there are a lot of medications that we cover that have lidocaine in them. So you'll see again, non-formulary. You can see, and I apologize, this might be a little bit grainy. It says tier 2, and I'm just going to keep scrolling because I am looking for the ointment. So I have found what I needed. I'm going to go ahead and click on it because, again, remember, there's a blue hyperlink. Zoom out just a tad. And the really neat thing is it is going to give you a lot of information all in one spot, which is why I prefer the online searching. I can see what drug it is, the strength, the status. And then again, we have the quantity limit and the prior authorization. Now on the PDF, you had to go out to another document, but from here you can see we have the hyperlink. So we can go ahead and click and it brings up, okay, so we know we're looking at the same drug still. And then it's going to give our quantity limit. So again, it's still the 150 grams per 30 days. And then we see the prior authorization. And it's going to go ahead and pull that criteria, so there's no need to go to another external document. It's going to tell you all the information that you or your provider could need in here. And then I also like it because if you scroll down and you forget, hey, I see it's a tier 4, but I don't recall what that copay is, it's going to tell you the definition of status, so the tiers, and then those copay amounts. And then if there's anything else, any of the other icons, you can click and see, oh, okay, just as a little refresher for what you might possibly see when you're searching for drugs. And then if you need to search again, you can just hit start over. We are going to now navigate back to, again, we're under Find a Drug, under Samaritan Medicare Advantage. And this time we are going to be looking for network pharmacies. So where can you fill the medications after they're prescribed? So you can click on the 2024 pharmacy directory. If you click here or here, it's the same link and it's going to be a PDF version. So this is a PDF version of pharmacies that are just in the state of Oregon. Now we do have nationwide coverage for Pharmacy Network, but this is just coverage that is local to Oregon. And you can see that it's broken out by county, city, and then pharmacy name. So from here, you can scroll and see everything that is covered in Benton County, in Corvallis, and find it that way. We do have sections in here that will tell you mail order. We do have sections in here if you're looking for like home infusion. That is one option to look for network pharmacies. And we also have a pharmacy locator. So this is, again, a more interactive tool. So it's going to take us to our vendor site and ask if we want to leave. And we can say, yep, we want to leave the site. And it's going to bring you to OptumRx Pharmacy Locator. So I'm going to go ahead and just type in Lebanon, and we're going to do, let's do a 20-mile radius. And I don't have a particular pharmacy that I'm looking for. I just want to know everything that is within 20 miles of Lebanon and hit search. So it says there's 28 results. And from here, it's really nice because you can just kind of start at the top, and it provides additional information if you click View Details. So again, you have the pharmacy phone number, and then any other information that that pharmacy has provided gets loaded in here, and you can see kind of some of the services they provide, their hours, if they have a website that is linked, if they're accepting new patients, anything like that. And the other cool feature about this is, let's say, okay, we want to find a mail order pharmacy. We can go ahead and click under Filter and Advanced Option Search and go ahead and click Retail Pharmacy Delivery and hit Update. And it says there are 9 results within 20 miles of Lebanon. So looking in here, we have the Pillbox, in Lebanon, in Corvallis, and again, we can go ahead and click down. This one does have a pharmacy website, so that's kind of neat. But then it's going to tell us, okay, here, pharmacy delivery, so we know that we're looking in the right spot. Let me see. I'm going to go ahead and stop sharing my screen. Perfect. And I think we covered everything in pharmacy. I know that we could probably sit here on the phone with you guys for another 30 minutes and talk to pharmacy benefits about all the questions you guys could have, but I know that we're allotted a certain amount of time. So I just want to say, if you guys have any questions, our customer service team, our pharmacy team has been trained on how to utilize these tools. So if there's a time where you don't have access to jump on and look at the formulary, certainly call in. Sometimes joining a new plan and learning how to navigate their website and find exactly what you need can also be daunting. So we just want to let you guys know that anytime you guys need anything pharmacy related, please don't hesitate to give us a call. And with that, I think I will turn it over to the next presenter.
Thank you, Marika. Hi, I'm Diane Ramos. I'm the supervisor with the Care Coordination Department with Samaritan Health Plans. And I was going to start out by talking about the health risk assessment. It might be something that you guys have heard of already, and you may have already gotten some phone calls. But the health risk assessment is a screening tool that helps you identify and understand your health risks and monitor your health status. You will be getting a phone call to complete this assessment. All new Advantage members gets this phone call for the health risk assessment. And based on the health risk assessment results, you may be referred to our care coordination department for further follow-up. The annual wellness visit, you may have heard of this before as well. This is a longer talk with your PCP where you can create a health plan together. It's not your typical physical exam. This visit is also scheduled after you've had your coverage for more than 12 months, and your PCP may remind you about it and talk to you about it. During this annual wellness visit, what is covered is a family health history review. They go over height, weight, blood pressure check. They do a cognitive impairment screening. They go over risk factors and treatment options. They go over screening schedules for preventative services, like things like colonoscopies. They go over your current providers and your prescriptions. They may talk about advanced care planning and just go over personalized health advice in general. What's not covered during the annual wellness visit is a complete physical exam. They don't do labs and other tests like EKGs. They wouldn't be talking about treatment for new or continued health issues. That would need to be a separate appointment. And they don't typically go over prescription medications as far as writing new prescriptions. And then I know you guys have had some questions in the chat, but regarding coverage of services, if you're already receiving treatment from a provider prior to coming on to Advantage Plan, Samaritan does honor all previously approved prior authorizations from other Medicare Advantage plans for services and medications not excluded from coverage by the Centers for Medicare and Medicaid Services or excluded from the transition of care per CMS, which is the Centers for Medicare and Medicaid Services. Another question, can a new Samaritan Advantage member continue to see an out-of-network provider? Yes, new members can continue to see the out-of-network provider for the first 90 days of coverage. That's considered the transition of care. After that 90-day transition period, any office visits or services provided by an out-of-network provider would require a prior auth. And Bruce, you're back.
Okay, thank you, Diane, and thank you to all of our team members who presented today. Great information. It's a lot. It's complex, but really good job going through an overview. We're going to transition now into a question and answer session. In our previous run-throughs, not everyone will want to stay around for this. So if you do, if you are going to be logging off, thank you so much for being here with us today. We really appreciate you, and we appreciate your engagement with us. So we'll just transition now into our Q&A session.
I'm going to do my best to make sure that I address all of the questions that everyone has put in the chat so far. There have been a couple of questions about being assigned a PCP that is not maybe the PCP that you see normally. So there was a little bit of a glitch in our system that caused PCPs to be assigned or maybe not your correct PCP. We are working through that on our end to get that corrected. But an easy way to get that updated, if you would like, is to contact customer service and tell them the PCP that you're seeing regularly, and they can update that for you. If you have a PCP assigned that isn't the one that you see normally, it doesn't mean that you have to see that one that is assigned to you. You can still continue to go to that PCP that you've established care with. There was another really great question about if Samaritan has an Office of Patient Advocacy, and if so, what is that contact information? I didn't know the answer to that, so I did a little bit of searching the Samaritan Health Services website while others were presenting, and it looks like we do have an option, so I'm going to drop a couple of links in the chat. The first one is to a contact us form on the website, and there's actually an option for patient advocacy, and it will automatically pull up an email that will go directly to that team. If you don't want to use the website, the email, I'll drop the email for the patient advocacy into the chat as well, so you can use that. A question about the deductible for Tier 4 drugs. Can that be explained, and at what point does insurance kick in? Rika, do you want to jump in and speak to that?
Yes, I can. So for the Premier plan, there is a deductible on the Part D. And Danielle, you'll have to remind me, is it $175?
Yes, that's correct.
Yes. Thank you. So there is a deductible of $175 for drugs that are on Tier 3, 4, and 5. So what that means is you would have to fulfill that deductible, that $175, before you would start paying those regular copays that you see associated with a Tier 4, 3, 4, or 5.
Thank you. And there's another question that just popped in related to this. If that's per drug, it is not. It's a one-time. Well, not a one-time. It's an annual total of $175, not per drug. So once you pay that, then you'll begin paying the standard copay. And another one for you, Marika. I don't know how to get my prescription sent to me, assuming that's the most cost-effective way to get it.
Yeah, so kind of like I walked through in the presentation, you can look at our pharmacy network locator and search for mail orders, or you can call us at customer service and we can look at mail orders for you. And mail order is a 90-day supply that they would mail to you. So we have lots of options. We have a very robust pharmacy network. Again, I said it was nationwide, and we have a lot of options for mail order, so we can help you get set up with that.
And while we're still on the subject of pharmacy, there is a question about if they're in their doctor's office sick and a med is prescribed, does the member need to check the formulary before they have the doctor call that into their pharmacy?
So you can certainly check the formulary and see if it is a covered medication, or you can have your provider check and see if it is covered. If they send it to the pharmacy and it is not covered, the pharmacy will then tell you at that point, hey, this is not covered. We reached out to your provider to initiate a prior authorization. So there's a couple different ways that can be handled. Again, you're welcome to look it up. Your provider can look it up, or you can always call us. If you're sick, sometimes you don't want to be doing extra things. So that's what we're here for. Feel free to give us a call and we can look that up for you too.
Great. Thank you.
Is it okay if I add on to that just a little bit too? Also, for the majority of things that you will be going to your doctor for that are, maybe more urgent, so things like antibiotics, those should not have prior authorization criteria on them. Kind of those more routine stuff that you would expect to get from your doctor for sickness, with the exception of per CMS, we can't cover any cough medications, anything over the counter. But that if you're going into your doctor and let's say you got pneumonia or something, those antibiotics should be covered, no problem.
Great, thank you, Katie. And how do members go about changing current prescriptions to a new?
Katie, do you want to go ahead and take that one?
I certainly can. So changing your prescriptions to a new pharmacy, what you'll want to do is you'll want to call the pharmacy that you are wanting to switch to. Let them know where your prescriptions currently are being held, and the pharmacies will actually handle that internally within themselves. So if you're doing something like I want to go from one Safeway to another, that's usually pretty easy. You just call the Safeway you want to go to and they can grab that. If you're wanting to maybe switch from like a Safeway to a Samaritan pharmacy, it usually takes a little bit more time because the pharmacies have to talk to each other and transfer the prescriptions. And if there's anything where maybe you don't have refills, then maybe perhaps the pharmacy needs to contact your doctor. So that can take about a day or two. So the sooner you can remember to do it, the better. But it usually is handled between the pharmacies.
Great, thank you. And I believe maybe the last kind of pharmacy related question I see there was a question in the chat earlier. If routine vaccines are covered for Valor members, I can go ahead and take this one, but Marika or Katie, please feel free to jump in as needed. So as a member of our Samaritan Advantage Valor plan, you do not have Part D as in dog coverage, which is your prescription coverage. So it wouldn't cover vaccines that are only covered through the Part D program. And a couple of examples of those are the shingles vaccine and the Tdap, that's the tetanus, diphtheria, whooping cough vaccine. But there are a lot of vaccines that are covered through the Part B as in boy benefit, which is the medical side, and you do have that coverage with Valor. So you would be covered for things like flu, pneumonia, hepatitis B, and the COVID-19 vaccine. Let's move on. I'll try to capture, oh, there's one for you, Bruce. Let's get this one out of the way first. How does the acquisition of the Corvallis Clinic by Optum affect those who have Corvallis Clinic doctors?
Okay, great question. I think the good news is that as of right now, there's really no impact. Corvallis Clinic is part of our health plan network, just like it was before. And I would add too that it very well may take a long time for that acquisition to be fully finalized. If indeed it does get finalized, it has to go through a lot of review with regulators and so on. As to what might happen if and when it does go through, well, we can never really predict the future. But as it happens, I was on a call earlier today with the CEO of another health plan in the Seattle area about some matters. And in the Seattle area, Optum has acquired several other clinics like the Everett Clinic and the Poly Clinic in Seattle several years ago. And what's actually played out in that market is that there has been very little, if any, impact on other health plan provider networks. Optum is maintaining all of its relationships with other health plans. And some of the concerns that were in the Seattle community that maybe Optum would freeze out other health plans besides United Healthcare have not played out. So I'm optimistic that that impact to our community will be very limited, if any. But as I said, we can never predict the future with entire certainty. Hope that helps.
Great, thank you, Bruce. There was a question about if the Silver and Fit fee allows members to go to multiple fitness locations or is limited to just one. We did have a savvy member in the crowd who supplied an answer to that, and they were correct. Yes, you can choose multiple. Try to group the questions about our over-the-counter benefit and the benefit card together. So one of the first ones was, can I use my OTC quarterly benefit to purchase CPAP supplies? The answer to that is no. That should be covered under the DME benefit through the plan. So you shouldn't need to use your OTC dollars for that. And those wouldn't be covered as part of that over-the-counter benefit. There's a question, what if I use a different product of an item that is in the catalog? The example provided is Refresh Advanced Eye Solution versus Refresh Tears. Can that be changed? So yes, if it's in the same kind of category of an item that's covered with, then it would still be a covered item. Excuse me. The examples that we have on the OTC list are examples of items that are most likely to pay in the retail setting. And then in our online catalog, those are the items available that our vendor has been able to source to provide you through that online option. And if we can always reach out to that vendor and ask them if they can source additional items for us. We can't guarantee anything that they'll always be able to, but we can certainly always reach out to them and ask that question. Is it a debit or a credit card is a question. So it does work as a credit card. You do have an option to select a PIN if you would like one to use it as debit, but you certainly don't have to. If you do want to have a PIN for your card, you do have to request that through the portal yourself. So there's no way for us to request a PIN for you and be able to tell you what that is. And that's for security purposes, because nobody should know your PIN number or PIN other than you. A question about went to a local Walgreens, bought a series of products that are marked as OTC eligible, but at checkout only one was covered. So this is something that we hear quite frequently through customer service. The items that Walgreens has tagged as being OTC eligible are really more for a flexible spending account program that people would have through a commercial insurer or their employer insurance. Most of those items are not necessarily ones that we can cover as a Medicare over-the-counter benefit. And then the other issue is that oftentimes brand items work better when making a purchase in the retail setting because of the technology behind the card, which I won't get into details on here, but generic items tend to not be as consistent because a store maybe hasn't updated their system to indicate that this generic item is in fact eligible per the technology that our card uses. So we know this is a hot topic for a lot of members, especially those of you that came, maybe from United or Regents where you had this benefit, but it worked in a different way, had some other technology available. So we are actively having conversations with our vendor. We're looking for ways to improve that experience for you in the future. There is a question about self-referring for a specialist. So we, as the health plan, do not require you to send a referral through us to go to a specialist, but a lot of times there may be a provider-to-provider referral required in that case, but we as the plan do not require you to submit referrals through us for specialists. Does the annual wellness exam require 12 months with Medicare or Medicare Advantage plans in general? Since most of you are new, do you have to wait 12 months? So no, there is a welcome to Medicare exam, and that's what is covered within the first 12 months of when you become eligible for Medicare in general, not just Medicare Advantage. So if you have been eligible for Medicare longer than that 12 months, then you don't need to wait to schedule an annual wellness exam. We will cover that. Will the credit card reject something bought by accident that isn't covered? So there are some things in place to protect from not paying for non-covered items, but I'll give an example. If you go to a vision provider and they charge you for the cost of your glasses and maybe the cost of the exam in the same charge, the card isn't going to know that it's paying for eyewear versus an exam. So in that sense, it's not going to reject the exam because that's not something that we have money on the card that we want you to be paying for. So you do need to be diligent in that sense, but it does have technology in place to prevent you from being able to buy over-the-counter items or things like cigarettes, alcohol, that sort of thing that wouldn't be covered by this benefit normally. If you purchase OTC at retail, do you pay OTC price or shelf price? I don't know the answer to that. I didn't know there was a difference in OTC price versus shelf price. So it would be whatever the register shows when they scan it. I'm not sure. Good question. Because annual eye exams are not covered, where does one go to get the annual glaucoma screening? So annual eye exams are covered benefit on our plans. You just don't use your benefits MasterCard to pay a copay for that service. So you do need your eye doctor to bill us for the exam, but we do cover one routine eye exam per year. And then a glaucoma screening is actually a separate benefit. Glaucoma screenings do not have a cost share. That's a preventive service. A pulmonary specialist, you need a referral. You don't need one through the plan. You would only need a referral if that pulmonary specialist requires you to have a referral from your primary care provider. And how do you transfer medical records from your old provider? Good question. I do not know the answer to that. Is there anybody else represented here that might be able to help answer that question? Otherwise, we can follow up with an answer to that with our frequently asked questions document that we'll send out next week.
Yeah, Danielle, I think that might depend a little bit on which provider a member is using. For example, if they were at Corvallis, if they were going to Corvallis Clinic as a new patient, the procedure might be a little different than if they were going to Samaritan Medical Group as a new patient. So most likely that's going to be a question to be addressed with the new provider. But as Danielle mentioned, we'll be doing a little bit more research on all of these questions that we can't cover quite as well as we'd like to right now.
Thank you. Okay, I think I got all the questions. Having glaucoma check coming up, does my doctor have to clear it with you first? No, as long as they're a in-network provider, you do not need to clear that with us. All right, that does bring us to the end of our scheduled time.
Okay. Well, Danielle, I just want to give a shout out to you for doing an amazing job with those questions and emceeing through that. There's a lot. And I want to apologize if there were any questions that we didn't get to adequately. Again, our team is going to be combing through all of the chat questions. And please do keep an eye out on your email. Both for the evaluation form, we'd love feedback, but also we'll be pushing out more detailed frequently asked questions and responses to that. Thank you all so much. We really appreciate you engaging with us for this time. Have a great